order of morphine for 2. And you know, I can't lie her back and put a neckline in because she won't lie down. Has she had any blood? She's going to get a blood transfusion. Is this a kind of, she's got this coil. Maybe they're feeling well if this I'll put your morphine dose as 2 milligrams. I came in, I had 8 patients under my care. By the end of the ward round, we had 11 patients under our care. That meant we had 3 admissions in the space of really an hour or an hour and a half, and that happens quite typically. How much has she had? I met her just now. A little bit more of the numbing. The PICU at Texas Children's Hospital is a 31-bed paediatric ICU. It's certainly amongst the biggest, when we look at our critical care service, which actually has 3 ICU areas. There's the PICU, there's the PCU, and then we have the cardiac ICU. We are probably the largest, if not amongst the largest, critical care services in the country. Are you in any pain? Where's hurting? Tummy? We admit children anything from just after the newborn period to older adolescents and even young adults, especially those with chronic conditions that require ongoing paediatric care. So what we try and do in the mornings is get our core business done, which is seeing every patient, examining every patient, creating a plan for every patient, ideally talking to their families. Let's do an X-ray and she will need some blood.
Her initial gas was 6.9 with a bicarb 5.
The Kangaroo crew are our hospital-based transport team. They transport around 100 children a month to the PICU or the PCU. The third patient was a patient the transport crew with who came from another part of town with what we call diabetic ketoacidosis, so a real exacerbation of diabetes. You start feeling better soon, okay? One of the areas that we've really grown in over the last few years has been in our ECMO program. I think this morning you'll have seen one of our ECMO patients who's actually been on support for about 50 days now. He's been to the operating room to have an operation which performs a special shunt. It helps the circulation by providing a communication from the aorta to the lung artery. So we wouldn't be able to do what we do without the team, and some of the real key players are obviously our nursing staff for me are ahead of anybody else. Intensive care has changed completely, I think, over the last decade in the focus on the family and the role of the family. And really nowadays I think no one would argue with the fact that the family is part of the multidisciplinary team. There's plenty of evidence now from neonatal literature and increasingly from pediatric intensive care literature is that family-centred care is not only nice for the parents but can benefit the child, certainly can benefit the staff, because family can become, to a point, a part of the care team. As difficult as it can be having a child in the ICU, I would hope that they realise and they trust that our staff, one of our most important roles is making that journey a bearable one, potentially a positive one for them, that they can see a light at the end of the tunnel, and also that because they're part of the team that they can come forward, they can ask questions, they will be listened to and involved in their child's care as much as we possibly can.